In this morning's Health Watch, a closer look at partial mastectomies. More than 200,000 women a year are diagnosed with breast cancer in the United States, and most of them choose a lumpectomy to remove the tumor.
A new study, though, finds nearly 1 out of 4 of those patients went back for additional surgery, sometimes more than once. Dr. Rache Simmons is chief of breast surgery at NY-Presbyterian Hospital, Weill Cornell Medical Center. She joins us this morning. Nice to have you with us. Almost 1 in 4 women need repeat surgery. Is that a high number? It feels like it is.
Well, I think it is a high number, and I think it depends upon whose surgery you're evaluating. If you look at people that do only breast surgery and a lot of breast surgery, the numbers are going to be lower. Certainly my numbers are much lower than that.
So you're saying it depends on who does it. That's one of the reasons that the numbers can be so high. Any other reason why it is so high?
I think it's a matter of judgment as far as, number one, how much tissue to take to make sure that you do achieve negative margins, but not taking too much tissue to compromise the cosmetic result. It's also judgment as far as who is appropriate for a lumpectomy and deciding that up front and talking to the patient about whether or not she really is an appropriate candidate for a lumpectomy.
See, yesterday in the meeting was the first time I even heard the term partial mastectomy. I didn't even know what that was.
It's the term insurance companies use, and it's a very bad term, I think, because it actually confuses and frightens patients. It sounds like more surgery than a lumpectomy.
It really does, yes. So really, a partial mastectomy really just means a lumpectomy.
Correct.
Is what you mean. You know what I also think was really disturbing is that it depends on the doctor you go to and the facility you go to, because you could go different places and get different diagnoses. Is there any way that we can get a handle on what's the right thing to do?
Well, I think it's important that patients ask their surgeon, number one, am I a candidate for lumpectomy?
And who is a candidate?
The patients that are a good candidate for lumpectomy are generally small tumors, although it really depends upon the size of the tumor with the size of the breast, relative to the size of the breast. We also often now get MRIs prior to lumpectomies, and that's really very important because that lets us tell if there's more cancer than we would see on mammograms or ultrasounds. And if so, the patient may not be a candidate for lumpectomy. And also, if there are multiple tumors, the patient may not be a candidate for lumpectomy. If you do a lumpectomy, you're just going to get positive margins.
So it sounds like it's one of these things that, and Gayle and I have talked about this a lot over the last few days, it always comes down to asking your doctor, and it's okay to get a second opinion in this case,
absolutely.
Right?
Yeah, it's so frightening when you go to get the mammogram and they have the thing, could you wait? We want to take another picture, or we want to take another look. And those are the worst minutes waiting for the results to come back. And what scared me a little bit about it is, should we just go ahead and have instead of having a partial, should we just go ahead and do it all at once? You know, so that you don't have to be a repeat customer, is what I'm trying to say.
There certainly are some patients that are better served with a mastectomy. And if you can tell that up front, either by the surgeon's judgment or by the MRI, then the patient really is better served having one operation and having the mastectomy.
Dr. Simmons, appreciate you coming in this morning. Thank you.
Thank you. It's a pleasure.